Hello everyone and welcome back to MediInsights. Today we explain Bepotastine Tablet, a modern antihistamine that can quickly ease itching, watery eyes, sneezing and hives, and we will cover how it works, how to use it safely, possible side effects, and practical tips for simple everyday relief. First up, let's cover what Bepotastine Tablet is for. Bepotastine Tablet is used to treat allergic conditions that commonly affect the nose, eyes, and skin. Patients with allergic rhinitis often take Bepotastine to reduce sneezing, runny nose, and nasal itching. Those with allergic conjunctivitis may experience less watery and itchy eyes after taking the medicine. People with chronic urticaria or hives may use Bepotastine to lower itching and to reduce the size and frequency of wheals. The tablet form delivers systemic relief for body-wide allergic symptoms, unlike eye drops that act mainly where they are applied. Clinicians may choose Bepotastine when first-line antihistamines do not control symptoms adequately, or when a patient reports bothersome itching despite other treatments. Bepotastine can be part of a combined treatment plan along with nasal steroids, saline rinses, or avoidance strategies for allergens. For seasonal allergy flare-ups, short courses can be effective, and for persistent conditions, regular dosing helps maintain symptom control. Patients appreciate that many experience meaningful relief within hours of dosing, though individual responses vary. The decision to use Bepotastine depends on symptom severity, previous treatment response, other medical conditions, and patient preference. Your healthcare provider will weigh these factors and suggest Bepotastine when the expected benefit outweighs any potential risks. Next, we'll go over how to take Bepotastine Tablet. The typical adult oral dose of Bepotastine benzoate is 10 mg taken twice daily, usually morning and evening. Your prescriber may recommend this standard schedule to keep symptom control through the day and night. Take the tablet with or without food according to your preference, and try to take doses at the same times each day to build consistency. If you miss a dose, take it as soon as you remember, unless it is nearly time for the next dose, in which case skip the missed dose. Do not double up doses to make up for a missed one. Dose adjustments may be necessary for older adults or for people with reduced kidney function, so your clinician will assess renal health before setting a long-term plan. Pediatric dosing differs and should follow specific pediatric guidance, so do not give adult tablets to children without medical advice. If your symptoms are severe, your doctor may change the dose or add other treatments rather than simply increasing the tablet frequency on your own. When stopping therapy, follow your prescriber's advice, because some allergic symptoms may return when you stop treatment abruptly. Always follow the written directions from the pharmacy and confirm any changes with your healthcare provider. Now, let's briefly explain how Bepotastine Tablet works in the body. Bepotastine works primarily as an antagonist of histamine H1 receptors, which blocks histamine-driven symptoms such as itch, vasodilation, and increased vascular permeability. By preventing histamine from activating H1 receptors, it reduces the immediate allergic symptoms triggered when the body encounters allergens. In addition to H1 blockade, Bepotastine has properties that stabilize mast cells, which lowers the release of additional inflammatory mediators during allergic reactions. The drug also inhibits eosinophil migration and reduces pro-inflammatory signaling, actions that help control the inflammatory component of chronic allergic conditions. These combined effects mean Bepotastine not only relieves the rapid symptoms of an allergic response, but it can also reduce ongoing inflammation that sustains symptoms over time. Because it is a second-generation antihistamine, Bepotastine tends to have less penetration into the central nervous system, which lowers the risk of sedation compared with older antihistamines. However, individual responses vary, and some patients may still experience drowsiness. Pharmacokinetic factors such as absorption, distribution, and renal elimination influence how quickly and for how long the drug works. Understanding these mechanisms explains why regular dosing is often more effective than occasional use for persistent allergic disease. Research studies have documented these cellular effects and clinical benefit in trials. Like all medicines, Bepotastine can cause side effects for some people. Many patients tolerate Bepotastine well, but as with any medicine, some people experience side effects that may require attention. The more commonly reported reactions include headache, mild drowsiness, dry mouth, nausea, and an altered sense of taste, which are usually transient. Less commonly, users report dizziness, fatigue, or gastrointestinal discomfort, and these effects often resolve as the body adjusts. If you experience severe dizziness, fainting, palpitations, or any sign of a serious allergic reaction such as swelling of the face or throat, seek medical help immediately. Report any rash that looks unusual or spreads rapidly, because this could indicate a more serious skin reaction. Compared with first-generation antihistamines, Bepotastine tends to cause less sedation, but you should still assess how it affects your alertness before driving or operating machinery. Because the tablet acts systemically, systemic side effects are possible, unlike topical forms that remain localized. Long-term use should be periodically reviewed by your clinician to ensure ongoing benefit and to monitor any emerging problems. If you combine Bepotastine with alcohol or other sedating medicines, the risk of drowsiness may increase, so avoid such combinations unless advised otherwise. Always tell your healthcare team about any new or persistent symptoms while on therapy. Finally, a few important things to keep in mind. Before starting Bepotastine, inform your doctor about all current medications, including over-the-counter and herbal products, so interactions can be checked. Mention any history of kidney disease, because dosage adjustments or closer monitoring may be needed for reduced renal clearance. If you are pregnant or planning to become pregnant, discuss the potential risks and benefits with your clinician, as safety data are limited and choices depend on individual circumstances. Breastfeeding mothers should consult their healthcare provider before using the tablet to balance infant exposure against maternal benefit. Avoid combining Bepotastine with other central nervous system depressants or excessive alcohol, since combined effects can impair alertness and coordination. Always follow the prescribed dose and do not increase the dose on your own if symptoms persist. Instead, seek medical guidance for alternative strategies. Keep a written list of your medicines to bring to appointments, and include any side effects you notice to aid decision-making during follow-up reviews. Store tablets in a cool, dry place out of reach of children, and check expiry dates before use. If symptoms return after stopping therapy, contact your prescriber to discuss whether restarting or changing therapy is appropriate. Thanks for watching MediInsights. If this guide helped you, please subscribe to our channel and leave a comment with your questions or experiences. And tell us what topics you want next so we can make more helpful medication guides today.